So, a warm welcome to the second stakeholder roundtable of the day on the crucial issue of adherence.
One of the areas that has the biggest potential for the ministers here to address is the area of adherence if they want to improve on the overall healthcare cost. There is about $270 billion worldwide to be saved if the adherence issues could be better addressed.
With communicable diseases, oftentimes they are what they are communicable. The malaria mosquito transmits from one person to another. The person with tuberculosis coughs and infects other family members. There's a variety of other vector-borne diseases. So by taking medication, by being adherent to the medication, a patient can also block transmission. They can protect their community from others getting the disease.
Is this just about complexity? If you could simplify people's drug regimes, would most of these adherence problems go away? We heard this morning about Mr. Chirac, whose mother was taking 12 to 15 medicines. If you could get her down to 2 or 3 medicines, would all these adherence problems suddenly evaporate?
Well, I still think that it's about the relationship between the individual, their community, and their healthcare providers.
If you look at the beliefs behind people's adherence or lack of adherence, it is very common features come up. It's, I don't quite trust this medicine, I think I'm being given too much medicine, I'm going to become resistant, I'm going to become dependent, I'm getting side effects. And that little voice inside somebody is driving that decision every day when they have to take that pill or not. Unless you've really got engagement, with the patient about this medicine, this therapy, which goes to the communication piece we're discussing, you're not really going to make inroads.
I think for the healthcare cost, it might be of importance is to focus more on medication review and therapy adherence, because it will contribute to, on the one hand, the health of people, and on the other hand, it is quite promising in curbing the costs.
I believe we need to do a much better job of communicating the impact of our medicines and the difference that they will make to people's lives. As an industry, we have, to a large extent, ignored the pharmacy industry, and I think we really need to partner far more, because the pharmacist is someone who is very approachable, who can give good information to the patient about their medication and help rebuild that trust.
But really, people will be responsible if, as you say, we trust that they're going to work, we have medicines that are suited to what we need, we've got regimens that are also tied up to it, but also if we make people responsible. And I especially love all the discussion around pharmacists, because I think they're a most underutilized resource that patients actually do trust. Patients trust their pharmacists almost more than they trust any other healthcare professional. How do we use them to engage them to be more of a partner in terms of helping the patients to take on that responsibility?
And what we think too often is that if you spend less time on a patient, it's cheaper. But it's the other way around, because if you look at the effects of not taking too much time for a patient, then you get all the complications that were being mentioned.
I don't think it is either I dispense lots of medicines or I speak to my customers. I think there is a good balance to be made there. I believe that we need to build into the medicines development process incentives to create innovations which will improve adherence.
Non-adherence shows itself as decreased efficacy in the real world. And, we all see efficacy drop down after a drug has been marketed, and it's estimated that half of that is due to it not being taken in the right way.
It's important to involve several actors to give the right information to the patients, include the pharmacist, nurse, doctor, and also the other healthcare professional player.
Reimbursement system is very important. Don't only pay for distribution, but also for the added value in terms of healthcare. But on the other hand, and that's the second issue, try to get an integrated system between hospitals and what we call in the Netherlands the first line. If you don't, then once again, you pay twice. Psychological effect on the health plans and insurance companies is that they don't want to pay for innovation anymore. and that they are really stubborn in to pay for adherence, etc. And I think that's the big issue and the big complication, which is, well, the result of non-integrated systems.
I would like to stress another aspect of non-adherence, which is the transfer between primary care and hospital and back, which is a big problem because the information is very bad, and it's a point. And in addition, we were speaking about integrated care. I think one of the points where integrated care is really not reality is between primary care and hospital.
My name is Maria Bellarano. I'm here representing REACT, Action on Antibiotic Resistance. I would like to stress here in relation to adherence that adherence is one of the main drivers of antibiotic resistance. And I would like to see what could be, I mean, here we can see which role can pharmacists play in prescribing the proper antibiotics or not prescribing them.
It always ends up about paying for things. We never have the ministries of finance involved in any of these discussions. We heard earlier today that the Ministry of Education should be here. We have ministers and former ministers of health, and that's really very, very important. But the people who tell us what we can do and how much we have to spend, whether it's in the private sector or the public sector, are the financial people. And we really should engage the ministries of finance into this.
I'm not a health economist, but I would just mention that I think it's a matter of really looking at the numbers, looking at the arithmetic, what makes sense. To me, pharmaceutical care makes sense because you may be paying for something up front besides the drugs, but you're avoiding a long-term cost that may come from lack of adherence or other things, adverse events that may happen to a patient.
I think the great innovation would be to build adherence into the drug development process.
A round of applause for all our panelists.